Welcome everyone to the Interagency Modeling and Analysis Group IMAG Multiscale Modeling Consortium webinar. And I am pleased to have this webinar today hosted by the Cell to Macroscale Working Group of the MSM Consortium. So I will turn the microphone over to Ed Sander.
Thank you, Grace. My name is Ed Sander. I'm co-lead for the Cell to Macroscale Working Group along with Minglong Lin, who has been the lead for a while. And today we're going to have Dr. David Eckmann and Dr. Ravi Radhakrishnan and colleagues discuss their work on bridging multiple scales, modeling targeted drug nanocarrier delivery. This work falls within the general scope of the working group to bridge subcellular and cellular phenomena with tissue matrix and macroscale phenomena of the whole tissue, and our attempts to learn from each other about different modeling numerical techniques in this area. A little background on Dr. Eckmann. He is the Horatio C. Wood Professor of Anesthesiology and Critical Care and Professor of Bioengineering at the University of Pennsylvania. And Dr. Ravi Radhakrishnan is Associate Professor of Bioengineering and Associate Professor of Chemical and Biomolecular Engineering at the University of Pennsylvania. Would you like to tell us about this interesting work, Dr. Eckmann?
Sure, I'll get things started. First, I'd like to welcome everybody to today's session, and we'll refer to today's webinar as the Real March Madness. I'd like to motivate the problem first to tell you about some of the briefly some of the clinical implications of the work that we're doing, and then I'll present some information about the experimental side of the work, and then Ravi will introduce the work that we're doing in modeling systems for this. So I'm going to share my display now. Okay, so first I'd like to give credit in this to our collaborators in this effort from across the Penn campus. This is work that can't be done by a single individual or even a pair of individuals. And we have a number of postdocs who are also working on this. Many of them are in the viewership today. And we appreciate their work. They'll be credited, I believe, at the end of the presentation. We also are very appreciative to the NIH for support and to the National Science Foundation, 3 distinct grants that have their own separate aims, their own goals, and work from each of those is represented in today's presentation. We deliver drugs in clinical medicine by many different methodologies. Some are things that we swallow. Some are medications that our patients inhale. Some are delivered transcutaneously through patches. Those might be pain medications, or they might be medications for breaking bad habits like smoking. Sometimes we implant devices directly into the body that can pump medications into desired spots, like this spinal infusion system. There are iontophoretic ways to deliver medications to various body parts that aren't well accessible to the vasculature. We do deliver medications in the hospital setting directly into the vasculature, and that can be on the venous side, as is depicted in this image, or we can deliver drugs directly on the arterial side through catheter-guided techniques utilizing fluoroscopy. Probably everybody in attendance today has taken some sort of medication, maybe by more than one of the routes listed here. Drugs can be delivered topically. We may use eye drops. We may have children who, during teething, we smear things onto their gums. Who suffer from baldness may use protein for hair restoration. We deliver local anesthetics. We implant drug-eluting stents into the coronary artery circulation. We have inhaled bronchodilators that are directed to specific sites in the body. We can give drugs in a regional way. For instance, there are surgical techniques to deliver drugs for malignant melanoma to an isolated limb that's affected by the disease. And we all take systemic drugs by oral ingestion or by intravenous administration. So drugs being delivered by any of these routes disseminate systemically via our circulatory system. And this leads not only to treatment of the illness or disease for which they are intended, but that can also result in local or systemic toxicity. Drugs of all kinds can promote promote and provoke immune responses. And of course, they can interact with other medications to potentiate both positive or to accentuate negative effects of the medications. And so in medicine, we would like to see only very highly specific and titratable effects of the things that we give for clinical therapy. And so while the drugs that we take may seem pretty smart, that this cartoon illustrates, in fact, we need to make them smart, and so we do that in terms of their formulation and in terms of their delivery. So in the formulation, it may be pH that makes the active molecule very accessible. It might be the size distribution. For instance, inhaled aerosols can deposit on the wall or the lumen of the airway, and so the size of the inhaled particulates will dictate where in the lower airway they land. They can be encapsulated for slow release. This is particularly true of oral medications that are designated SR, or slow release. And then we can have chemical modifications that can help to avoid undesired responses, such as immune reactions, or to make drugs formulated in a way that they escape the reticuloendothelial system or the macrophage that would tend to dispose of them before they can have their positive effects. And one that we are very focused on is in direct site specificity for medications that are delivered intravascularly. So our goal is to create what might be popularly, or in the lay public, referred to as magic bullets. And this is really what we want. While the tissue may be a very large target in general, we really want medications that are delivered to have a very select focus on a specific target, be that a site of inflammation, a site of cancer, an epileptic nidus in the brain, etc. This is really how we think about the problem. And so this means being able to get to a much smaller length scale in drug delivery. And for targeting in specific, it means we have to work at the nanoscale, because that's the molecular length scale at which binding and uptake and so forth into cells occurs. And so while we typically take drugs at home on the macro scale, the future is in being able to use the nanoscale so that things are at the very smallest length scale to be biologically relevant. So here's a simplified overview of targeted drug delivery. And if my cursor is showing, so here's a formulation where there is a drug carrier of some sort, and there are many different types of carriers, as you'll see momentarily. Inside that is the drug, which could also be decorated along the surface, but more importantly, on the surface of this drug carrier is some kind of targeting molecule that has molecular specificity for binding to a receptor that is present on the surface of a cell. For our purposes, our targeting interest is endothelial cells for vascular drug delivery. Once that targeting ligand binds with the receptor on the surface of the cell, then that complex can be taken up into the cell and its cargo can be dispersed in the cell. And so this is a way for trafficking to occur in order for the precious cargo in the nanocarrier to end up intracellularly in a very highly focused, site-specific, molecularly directed fashion, rather than systemic delivery that will go to all kinds of cells throughout the body, throughout specific organs, without necessarily targeting the diseases. So therefore, drug packaging and targeting by this nanotechnique gives us an intravascular method of targeting nanocarriers, which holds promise for personalized medicine. We can therefore clinically optimize drug transport. That, however, requires an accurate description of how those tiny carriers will move in the bloodstream and what will happen when they get very near the cells of interest, endothelial cells that line the blood vessels. And so we use a synergistic computational approach in synergism with experimental methods to determine delivery, high throughput, complex motions, nanocarrier design specification, to really categorize the molecular events and the membrane dynamics, which are not accessible by typical techniques of imaging and other methodologies. So as you will see in the second half, we really get into the hydrodynamic interactions and the binding mechanisms, which are important in the description here. So nano offers us great potential, but also raises a lot of questions. It's a very simple question to begin with. What is the difference between a 100 nanometer diameter spherical drug carrier and a 200 nanometer diameter spherical drug carrier? Well, of course, one is twice the diameter of the other, meaning that its volume is 8-fold larger. So which is better off for us to do? Give 8 100 nanometer diameter particles carrying drug, or one 200 nanometer diameter particle carrying drug? We don't know the answer to that. So here are a list of questions that we could ask. What are the right types of carriers? What are the molecular targets? What are the molecules specifically that we can use as targeting molecules? How are drug carriers constructed and loaded? How are the carriers administered? How do they reach diseased tissues? How are they internalized, and how are they trafficked by cells? How is the drug released from the carrier? Is this a more effective or less toxic way of giving drug? How is any of this optimized so that we pick all of the right characteristics? And there are more questions beyond that. So on the first question, experimentally, we can begin to look at different types of carriers. And so here are many that are demonstrated on the right side of this image. Liposomes, polymerisomes, we can use surface functionality, we can have various shell structures, we can have phyllomicelles, etc., dendrimers. There are many different particles, and as you might imagine then, that lends to a huge amount of experimental opportunity for us to explore. In fact, an overwhelming amount of experimental opportunity. Similarly, there are many different molecular targets. So here's a partial listing of different molecular targets. And for our purposes, we're focused on, we would divide them into two categories, really. Endothelial cell markers, which are primarily markers of inflammatory diseases. So intercellular adhesion molecules such as ICAM1, PCAM, others which might include integrins. And then, of course, there's enormous interest in treating cancer this way, so the tumor cell markers for a variety of different cancers that have already been identified. So you can think of this as vascular targeting, and you notice the asterisk there, so our targets would include diseases such as acute lung injury and ischemia reperfusion injury that's important in lung transplantation and in cardiac surgery. So these would be hydrodynamic considerations for vascular targeting. And then there would be the non-vascular, which have many other important considerations for diseases that are not directly linked to vascular drug targets. In vascular targeting, we have a great opportunity because we can do experiments for which we can impose control. So you can see here I have, in the bottom of this slide, this is meant to depict a parallel plate flow chamber or the inside of a blood vessel that is lined with endothelial cells shown along the bottom, and on those endothelial cells are receptors of some sort. In the flow, here's the flow, in the flow there are nanoparticles that are decorated with a targeting molecule that has molecular specificity for binding high affinity for that particular receptor. And so in such an experimental apparatus, we have control over the numbers and types and sizes and so forth of the carriers, including how they are decorated. We can impose experimental control over the flow characteristics, so we can change the shear stress, or we can change from steady to unsteady flow. And then we have some degree of control over the cellular milieu. For instance, endothelial cells, when exposed to TNF-alpha, will markedly upregulate the expression of ICAM1 on the surface. So we can look at a variety of different combinations here, but as you can imagine, this could be exhaustive to do in experiment, hence the interest in developing computational methods to address this. So here are a few kinds of results that we can generate from these types of experiments. So this is an experiment done where we vary the amount of antibody, in this case an anti-ICAM antibody, on a spherical drug carrier. And so we look at ranges from 4,100 down to 370 antibodies per square micron. For a 100 nanometer diameter particle, this would be at maximum about 220 antibody molecules. These are experiments for larger objects than that, simply because of the optical limits of fluorescence microscopy. But as you can see, when we use either very low antibody coverage or we use non-specific antibody, IgG, we end up with very small amounts of carrier binding to cells as a function of time. At larger surface coverage of the carrier object with antibody, we enhance the amount of cellular binding that occurs. So these are things that can be done by a fluorescence microscopy. We can look at this over long times as well, so that we can see the dynamics here out to the point of saturation. Likewise, we've developed techniques by which now we can synthesize particulates or nanocarriers that have some additional complexity that we can load them with drug, and we can control size distribution, we can control the conjugation of antibody, and we can control features such as the amount of cross-linking that occurs that will affect the drug release profile. So in this work, we've developed a dextran lysozyme nanogel. Our nanogels are from about 120 to about 140 nanometers in diameter. You can think of it as a lysozyme core with a corona of dextran. The beauty of the dextran is that it is easily oxidized on the surface and therefore can be functionalized with antibody, as is shown in the far right of this cartoon image. In this particular experimental protocol, what we have done additionally is to add an anti-inflammatory drug, dexamethasone, which is a steroid, and we have used this then to characterize the drug release profile from this. So here's an example where we can use liquid chromatography techniques, for instance, to look at the drug release rates from these nanogels, and they follow Langmuir kinetics, and so it's very easy to translate that to a computational scheme. And you can think of this in a way as being, for a deliverable, this is almost a homeopathic dose of steroid that's in the nanogels, but because of the targeting, we can get very high site specificity. In vivo, the lung itself expresses a considerable amount of ICAM1, much more so than in other targetable organs. And here we show what this site specificity does, that we can get about 16-fold enhancement of ICAM-targeted nanogels to lung tissue compared to IgG-targeted or non-specifically targeted nanocarriers in lung tissue. And you can see that it's not so much different in other organs. And so therefore we have a nanogel that's very useful in this instance for a direction to an inflamed state in lung. Now, in an animal experiment, we have delivered our nanogels in a mouse model. This is an IRB-approved protocol at Penn. And we also give endotoxin or a lipopolysaccharide to mice, which causes an enormous immune response and inflammatory response in the lung in particular. When we collect blood, organs, tissue, etc. from these animals, we're looking for any form of protection that's been incurred because of this specific targeting via these nanogels that are drug-laden. And this is a result that simply shows, if we just focus on the comparison here, what we have found is that the inflamed state or the non-inflamed state of the lungs in those animals that received not only the lipopolysaccharide, but also received our dextran nanogels, lysozyme dextran nanogels, that are not only targeted with an anti-ICAM antibody, but also contain dexamethasone in essentially a homeopathic dose, that the expression of ICAM and VCAM in the lung from these animals is normal. And so nearly perfect protection has been achieved for these animals. So that's just an example, and you can find many more examples of this in the literature of groups that have produced various forms of nano-targeted drug deliverers that can be loaded with drug and show a positive effect in vivo. But that still leaves us with many, many questions, and those pertain to the hydrodynamic interactions and binding for purposes of interaction. So as you will see in the work that Ravi will be presenting shortly, this is a way that we can represent things for understanding nanocarrier binding and uptake and delivery and so forth at length scales that are difficult to access in experiment, but that there are allied experiments that we can do for purposes of very functional comparison. So our goal is to understand these lingering questions about these magic bullets for drug delivery and disease treatment. So we'd like to know, how can we optimize this? What are the right carrier sizes, shapes, types of drug carriers? How should they be delivered? In what concentration into the bulk into the bloodstream? How much of this should we give? What kind of surface density should we put on the of target molecules or linkers on the surface? And what kinds of drugs can we or can't we deliver this way? And then more advanced questions. What about efficacy clinically and toxicities? And at present, the evidence for this is relatively scant because those kinds of studies, we haven't advanced to that state yet. So the big questions are, what kinds of studies clinically should be done first as these things get developed? And really, it's the interplay between the experiments that we can do, that we can control nicely, to relate them to the physiology that we can reasonably control, but then to understand things with much greater refinement through the computational techniques that I'll now hand over to Ravi.
Okay, thank you. So thanks, David. So I too would like to thank the working group leaders and also the IMAG chair, Grace Peng, for giving us this opportunity to share with you some of the work that we've been doing. And I'm particularly going to focus on the details of the mathematical models that we've been working on, very closely synergizing with the kind of experiments that David was describing earlier. Before I actually start, I just wanted to acknowledge the postdocs that are primarily involved in doing this work. They are listed over here: Shu Yu, Ram, Arjit, Helena, and Yeo Hong. So the main objective, at least the long-term objective for us, is to actually develop what we call next-generation pharmacological models for targeted drug delivery. And we are essentially focusing on, of course, the molecular scale, because that's where the specificity comes from. But we want to be able to build models that can take the molecular scale predictions all the way up to the organ scale, such that they can directly relate to in vivo experiments, or maybe even translatable to actually be synergistic with clinical predictions and things like that. So throughout the talk, you will see that we choose our formalisms and models and approximations and things like that suitably to satisfy both of these objectives. And of course, just by way of very short introduction, my group and also the people that are involved in modeling, especially Dr. Ayyaswamy at Penn, we are very interested in modeling at very different length scales, and also trying to bridge models at different length scales. And I'm sure this type of a slide is not new to this audience, but I just wanted to focus on particularly the kind of bridging that we are involved in currently. In particular, how do you actually relate molecular scale predictions to coarse grain models, and how do you actually relate coarse grain predictions to continuum models? And hopefully I'll give you some examples of how we've been able to do that in this presentation. So just as way of outline for this modeling part of the talk, essentially, I'll first talk to you about a model that we've been developing to predict nanocarrier binding affinity, and how we have used this model, and stretched it to actually predict not only things in cell culture, but also things in vivo. And then I'll switch gears a little bit to talk about the role of hydrodynamics, and in particular, our attempts to start building hydrodynamic models at the full organ scale. And so this is what I call system-wide pharmacological model. And of course, towards the end, hopefully I'll have time to talk about more rigorous treatments, which essentially are more faithful to multi-body hydrodynamic interactions and things like that. So jumping in, David illustrated the point about targeted medicine very nicely by way of several cartoons. And one of the first things that I'm going to do is to mathematize these cartoons in the language of Rob Phillips, who's the author of Physical Biology of the Cell. How do you actually know that these cartoons are quantitatively faithful to the way we understand things? So one of the first things that we ever did in this area is to try to develop quantitative models for adhesion of nanocarriers. And so the way in this cartoon is that you have this nanocarrier of a given size decorated by antibody density, and it's essentially targeting and binding to a cell which is expressing certain number of receptors, and the receptor binding is very specific to the type of antibody that you put in. And the kind of parameters that we put into this model is we give this nanocarrier full translational and rotational free degree of freedom. So it's free to translate and rotate. And every time you have an antibody encountering a receptor, you have the ability to bind. And the binding free energy for that interaction is actually something that we import directly from experimental data. We also include certain molecular characteristics. For example, each of these receptors are transmembrane receptors that essentially jut out about 20 nanometers from the membrane surface, and they can flex. And so we introduced the energy landscape for flexure, which essentially comes from some indirect flow experiments, but we've also been able to do molecular dynamics experiments, simulations, to determine the flexural rigidity of these receptors. And so the point is that when we build this model, we directly determine the parameters that go into the model from either independent experiments or independent molecular dynamics or microscopic simulations, and then we don't alter the parameters anymore. So essentially, we construct an ab initio zero-fit model that way. One of the first things that we realized is that the nanocarrier avidity, or the binding affinity, which the experimentalist measures routinely, also happens to be an exactly computable quantity. So if you think about the nanocarrier reaction as the nanocarrier binds to the cell, giving you a nanocarrier cell complex, which is this LR, then we can formally define, based on physical chemistry, an association constant, which is essentially related to the probability that the nanocarrier will be bound relative to the probability that the nanocarrier will be unbound. And these two probabilities would depend on things like the loss of translational entropy upon binding of the nanocarrier, the loss of rotational entropy of binding of the nanocarrier, and also the loss of translational entropy of all the receptors that are being engaged in multivalent interactions. And we can then use statistical mechanics to actually work out what appropriately these terms are going to be. And this is basically how we construct an exact computable quantity. And the nice thing about this expression over here is that based on doing Monte Carlo simulations of this cartoon, we are able to figure out each and every term to a fair degree of accuracy. I would also like to note that while the avidity itself is a measurable quantity which we can directly compare with experiments, each of these individual terms, which represent rotational entropy, the translational entropy, as well as the binding, are also separately measurable experimentally. So these are all separate experimental observables. For example, antigen entropy change can actually be inferred based on super-resolution fluorescence experiments, and the binding landscape can be probed by atomic force microscopy. And so we use not only the overall validation between theory and experiment, but we also subject each and individually each term to separate experiments. And so we over-constrain the way we compare between model and experiment. And so if all of these comparisons are satisfied, that's only then do we accept that this model is good. So that's actually a protocol that we built in terms of validation. So just to give you some idea of what kind of predictions we can make, here I'm showing you on the left an energy landscape that has been computed based on this model using Monte Carlo simulations and a free energy technique that we've used in the past. What you're seeing is as you bring the nanocarrier from far away to the cell towards the cell, so you're decreasing the distance between them as you decrease Z, you notice that there is a point at which you start engaging the first receptor-ligand interaction. The closer you push the nanocarrier, you engage the second one, the third one, et cetera, et cetera. So we can track multivalency of 1 to 2 to 3, and of course you can also get higher order multivalencies. But essentially this plot tells you the watt value of multivalency is the most optimal to give you the lowest free energy or the highest binding, right? And that's essentially what is tracked over here. On the right, what I'm showing you is essentially in a multivalent engagement of receptors and ligands, what is the spatial pattern the receptor-ligand bonds actually form on the cell surface. Sorry, was there a question? Okay, so on the right, what you're seeing is the distribution of receptor-ligand bonds on the cell surface, which is essentially predicted by our model. But these are essentially fluorescent patterns that one can track using super-resolution fluorescence experiments as well. So we can then put all of these together to go back and infer what the overall avidity or the association constant is. And then we can actually predict binding isotherms of how as a function of nanocarrier concentration, how much binding would you actually expect in the cell, from which we can actually pull out the nanocarrier avidity or the dissociation constant. And that can actually be compared to cellular experiments, the kind of experiments that David was mentioning. And here's an example of such a comparison. It turns out that one of the we can try to understand the effect of flow fairly early on, even in the simple equilibrium model. So in this case, what we have done is to use steady shear flow and introduce the effect of steady shear flow through an effective potential. We can actually start to learn some very new physics that was very counterintuitive to begin with before we actually did these calculations. And one of the things that you notice when you do these types of experiments is something that is discussed in the literature fairly controversially as shear thresholding. So for example, if you slowly switch on shear and impose a shear force, there is a small shear force regime in which you actually enhance binding of the nanocarrier to the cell, and then once the shear force reaches a certain threshold, you actually start decreasing binding. And so this idea of shear thresholding is discussed in the literature always in the context of catch bonds. But one of the things that we have been able to show is you actually don't need any catch bond behavior to show shear thresholding. This is purely an effect of how the shear flow interacts with the multivalent interaction. So the catch bonds do not actually play a role in this effect. And that's something that we've been able to show and also quantitatively match this type of shear thresholding behavior to experiment. So now to in vivo prediction. So one of the things that we've been able to use this model to predict is what would be the effect of the surface density of antibodies on the overall affinity. So this is essentially association constant on the x-axis on the left plot. As you increase the association constant, you have better binding. And if you put no antibodies, which is at 0, and 100% antibodies on the nanocarrier, which is about 200 in this axis, then essentially we can cover the entire range. And one of the things that we noticed is that as you keep increasing the antibody density, you actually get rather nonlinear behavior. You initially get very weak dependence until you reach a threshold, and then you have a jump, and then you get weaker dependence again. And this type of threshold behavior is very important to determine because it's only above this threshold density does the nanocarrier actually, the targeting actually prove effective. Below that threshold, it's as though you do worse than packaging the antibodies into the nanocarriers. The other thing that you notice is that once you cross the threshold, it doesn't really give you too much benefit to actually further increase the antibody density because you have a fairly flat dependence. And so you can get away by as small an amount of antibody density as long as you are above the threshold, because that would allow you to suppress things like immune response and things like that. So you actually get very good pharmacological insight based on these types of predictions. And one of the things that we have done is, of course, to compare our computational prediction, which is on the colored plot on the left, with in vivo predictions in mice. Again, this is endothelial targeting in the lung of mice. And you notice that in vivo, even in vivo, you quantitatively get this type of thresholding behavior. And not only that, the location of the threshold is almost quantitatively matching to what we predicted using the computational method, which essentially is a very nice and powerful validation for this type of a model. So the next thing that we've done is to actually do the kind of experiment that David suggested, which is to try to address selectivity in a given tissue. So we took two mice models. One was normal mice, and the other was a mice model with inflamed mice called LPS mice. And as David pointed out, the LPS mice has an it's inflamed, so it has an overexpression of ICAM. And it's believed in the pharmacology community that the overexpression is about 2 to 3-fold. So one of the things that we used our model is to actually predict not when the antibody, the nanocarrier would bind the most tightly, but rather when the antibody would actually, when the nanocarrier would actually give you the maximum selectivity of binding between the normal mice and the inflamed mice. And one of the prediction was that if you operate at full antibody density, you actually don't get that much selectivity. You only bind about 1.5 times better in the inflamed mice compared to the normal mice. Whereas if you scale down the antibody density to 25%, then you actually get a 4-fold effective selectivity. And this was again born in vivo when we did the experiments. This was done by Vladimir Muzykantov and his postdocs, where they have shown that you get a very similar in vivo dependence of the selectivity. So if you operate at 50 antibodies per nanocarrier, the selectivity is about 4 to 5-fold, whereas with 200 antibodies per nanocarrier, which is 100% saturation, the selectivity is not that great. And this was done using positron emission tomography experiments. So just to give you a brief overview of where we are going with these types of models. So clearly, we are able to do something in terms of in vivo predictions. So that's fairly good. But one of the things that we are extending this model to is to actually be able to predict targeting in live cells, which takes into account things like cytoskeletal pinning, membrane tension, membrane fluidity, and the polarization of the cell, and whether the cell is fluid active, things like that. And this is work in progress. So I give you an example. If you think about two types of cells, say a regular endothelial cell versus a macrophage, you might think of the macrophage actually having a large amount of excess area in the cell. And clearly, when a type of cell like a macrophage having large amount of excess area would clearly have influence in how the nanocarrier actually binds to that membrane surface. And so one of the first things that we have done is to include membrane undulations as part of our prediction of the adhesion landscape. And here we are showing you, for example, that depending on how much excess area of the membrane you have in the cell, you can have very different behavior of multivalent interactions. And in ongoing work, we are trying to examine the free energy landscape associated with these types of differences and so on. So this is actually work in progress. Another effort that we are doing in similar spirit is to actually introduce different ways of conjugating the antibodies. So in all the work that I've told you so far, the antibodies have been directly conjugated on the nanocarrier surface through irreversible hydrophobic attachment protocol. But one can get much more control if you actually introduce tethers. And then you can not only control the surface chemistry and the length of the tethers, but also the configuration of these tethers. And one of the things that we are building right now is to use polymer physics models based on Womelak chain simulations combined with the way that we do Monte Carlo to actually put together the effect of these types of tethers. And of course, in this case, one of the interesting aspects is if such a conjugate is introduced into flow, then there's some very nice interactions between the tether dynamics and the flow field itself, which we actually captured through a cross Hamiltonian. So this would be an example of how you can bridge two different formalisms, one that comes from polymer field theory and the other that essentially comes from hydrodynamics, and actually introduce them into the same scheme. So these are all ongoing work. that we hope to realize in the near future. So now I'm going to shift gears a little bit and clearly talk about an important aspect of this problem in design, which is essentially hydrodynamics. So clearly, any pharmacodynamic model at the system scale cannot ignore hydrodynamics because it plays such a central role, especially in vascular drug delivery. And so how do you actually couple the near-field models, which essentially tell you the molecular interaction between the nanocarrier and the cell surface, and the system-level model, which essentially includes the hydrodynamic interactions due to the vasculature. And so we have essentially taken two approaches to do this. Of course, the rigorous approach would be to rigorously treat hydrodynamic interactions using very rigorous numerical simulations, which I'm going to talk about. But oftentimes we realize that we will be severely limited in the time scale we can explore through these rigorous methods because, of course, these are very computationally demanding calculations, and one can never realize the pharmacodynamic biological time scales. And so what we did was we've simultaneously used another approach where we can actually access the biological timescale, and that's what we call mean field model. So what I'm going to do is to start talking about the mean field model first, and then I'll start talking about the more rigorous models. So one of the ways in which we think about the mean field models is through the formalism of what we call generalized Langevin dynamics, which has the ability to include various temporal correlations into the consideration of the model without actually doing a fairly intensive calculations. And so the example would be what we've talked about in the adhesion model. It clearly happens at this very, very small length scale, very close to the cell. But really what happens at the much larger length scale, where the nanocarrier actually interacts with the particulate nature of the plasma with other blood cells and platelets and things like that, and how does the overall hemodynamics actually impact that process. And so what we have done is to change the problem around to ask the following question: how would a nanocarrier actually feel on an average statistical sense the presence of these types of larger blood cells, right? And so one of the ways you could do that is to actually introduce what we call a marginating potential. So rho RBC is an example of a marginating potential. It is essentially the potential felt by the nanocarrier because of the presence of the blood cells. So the question then is, how would you first calculate the potential? And secondly, once you calculate the potential, how would it actually impact the nanocarrier motion? Well, it would impact the nanocarrier motion because the marginating potential would impact the velocity correlation as well as the positional correlations of the nanocarrier itself. So the question then is, how do you then determine these and how do you actually put them together? So one of the simple things that we have done initially is to represent the role of the particular nature of the blood by ignoring the shape and the deformability of the blood cells, but rather by just considering them as spherical particles at some given hematocrit density. And we would like to know if such a particulate is flowing in a circular vessel, how does it actually impact the nanocarrier motion? And the way we think about this is to first write down an n particle Smoluchowski equation, where here n particles represents the n RBCs that are in the system, right? And so we can write a probabilistic flux balance, which is essentially the master equation for the system. And then to make this tractable computationally, we average over n-1 particles and focus on one representative blood cell. And so this would then give us a one particle distribution, right? And this essentially forms the basis for, in the literature, what's known as dynamical density functional theory. So the one particle distribution is mean field because we are essentially representing the 3n by 3n dimensional diffusion tensor, which depends on the translational motion of each and every blood cell in the system, by constructing a 3 by 3 diffusion tensor, which essentially tells you what the translational diffusion tensor of one blood cell is on an average field due to the presence of its neighbors. And then, of course, the blood cells are going to be packed very differently because of the confinement. And that packing is taken into account by constructing a free energy functional that comes from density functional theory, and hence the name dynamical density functional theory. And there is a large literature which spans about 20 years or so in the chemical physics community that have developed very good functionals for both spherical as well as non-spherical particles. So we can put this together, and then we can take into account the effect of flow, because the master equation explicitly represents the flux. So the flow is taken into account. And then if we solve this one particle distribution function, we can essentially write down a closed form expression for the density, the spatially inhomogeneous density profile of the blood cells. And it depends on this quantity called the direct correlation, which essentially is physically akin to the effective thermodynamic force felt by due to the free energy of the particle. And it depends on the external force, which in this case would be the presence of the bounding wall of the blood vessel. And it also depends on the flow profile, which essentially comes from this third term over here. So if you put these together and solve the dynamical density functional theory equations, then for any given flow field, for example, here's the Cousin flow profile, which you would expect in a cylindrical channel of flowing blood, you can then predict the marginating potential. So here, if you have no flow, then of course the RBCs are going to be everywhere in the system. But as you keep switching on, increasing the flow rate, what you notice is that you essentially first create a cell-free layer, because essentially all the RBCs marginate towards the center. And such type of a marginating effect essentially is captured by the dynamical density functional theory. And from the spatially dependent density distribution, we could then infer this marginating potential, which is essentially the potential the RBCs are going to impose on the nanocarrier. And this function, or the gradient of this function, which is the negative gradient of this function, which is the force, is what the nanocarrier actually feels. So as the nanocarrier is trying to explore its own adhesive landscape, on overlay on top of it, you actually get this marginating potential. And of course, the nature of the dynamics of this nanocarrier is going to be dependent on the nature of the hydrodynamic correlations. And in order to put that in explicitly in this type of a model, what we do is we separately determine the hydrodynamic correlations either from experiments or from direct numerical simulations or more advanced methods that are more faithful towards hydrodynamic interactions. And then we use the velocity autocorrelation functions from there to actually infer the nature of the stochastic noise that we need to put in. Right? So this is essentially the approach that we have taken in building the generalized Langevin equation. So these noises are not just the Brownian noises because they actually have memory to them, because we take into account the explicit interaction between the nanocarrier and the fluid, which is essentially embedded in this noise functions. And so rather than thinking of them as white noise, these are actually what is known as the colored noise, because it actually has this memory-dependent term. And we actually evaluate this memory-dependent term either through direct numerical simulations or more advanced techniques, or from experiments, single molecule experiments. And so if we put that together, then we can actually solve this generalized Langevin equation and actually predict the dynamics of this nanocarrier, both in the presence of RBCs, but also in the presence of these types of hydrodynamic correlations. And of course, things like multivalent interactions and things like that can simply be taken into account by introducing the suitable free energy landscape that we have determined from the Monte Carlo simulation. So this is a very nice platform where we can actually integrate several different schemes. And so this is a platform that we've used to actually bridge the very different physics that's coming from these different models. And then the predictions would be things like what would be the nature of the dynamical correlation of the velocity of the nanoparticle as the position of the nanoparticle as it encounters these different environments, and also how does the probability of the nanocarrier tip change as you include things like flow, things like hematocrit density, and things like that. So this is very faithful in the way it actually incorporates these different physical effects. And here is an example of how all of these have actually come together in this rather mean field approach. So clearly, the mean field is just one part of the equation. And like I said, the main reason why we do these types of simplifications is because we can now use this model to actually predict margination of the nanocarrier in an entire vasculature tree. So imagine we go to a clinical database and actually download the image of an entire vasculature tree, then the model that I presented here is computationally tractable enough that I can implement it in such a large scale and actually predict the distribution of nanocarriers across the entire tree, which would simply not be possible by doing a finite element calculation, for example. But having said that, there is a role to actually knowing the hydrodynamic interactions in a much more precise fashion. And that brings me to kind of the second aspect, which is how do you actually incorporate more rigorously the full hydrodynamic consideration. So I'm not going to spend too much time in this just because we are short of time. But here's one example. So in one of the examples that David mentioned, which is this dextran lysozyme nanogels, which are these highly flexible molecules, you might imagine that one can not only have significant hydrodynamic interaction between the entire nanogel and the fluid, but also internal hydrodynamic interactions between the dextran fibers themselves. And that would play a huge role in how the nanocarrier essentially sees the hydrodynamic environment in the vasculature. And so we have built this star polymer-like model with appropriate cross-linking that essentially comes from experiments. And then we have used a Brownian dynamics framework to actually represent the explicit hydrodynamic interaction not only between the entire particle and the outside fluid, but also between each and every strand of the membrane. So here's an example of how we can predict the deformation profile of such a nanogel in the presence of different shear flow. This is without the presence of any bounding surfaces. And so you can see, so this would give us an ability to actually predict how deformable these nanogels are, which is actually very hard to determine from the experiments because these nanogels are rather soft and we think that they can actually deform quite well. So this is one of our first modeling efforts that actually tell you that as a function of cross-linking of the dextran and as a function of shear flow, here is a prediction of how deformable these nanogels are. And of course, we are now in the process of actually computing internal stresses and relating them to these types of strain behavior to get overall elasticity predictions and things like that, which would then be validated through in vitro AFM type experimentation. Another approach that we have taken to include hydrodynamic interactions is using the approach of fluctuating hydrodynamics. So this is the way we directly solve the Navier-Stokes equation, but by introducing stochastic forces as well. This is just an illustration of how we have done. This is published work, so I'm not going to talk too much about it. But essentially, here we are shown that using this type of fluctuating hydrodynamic approach, we could not only treat the stochastic interaction of the nanoparticle with the fluid, but also simultaneously be faithful to the way we describe the adhesive linkages. So we simultaneously are faithful to the hydrodynamic correlations. We are faithful to the statistical mechanics. Here is essentially showing equilibrium behavior of velocity distribution, and we are also equally faithful to the free energy landscape due to any adhesive interaction. So this is one of the models where we have shown that all of these important properties can all come together and be simultaneously validated within the framework of a single model. And of course, we are using this type of approach now to actually study multi-body interaction. So now if we have a particulate, explicitly represented particulates of the blood plasma, where we can actually start resolving things like multi-body hydrodynamics using this approach. And of course, we can also use this to actually study more complex geometries, such as branch flows and things like that, which would allow us to essentially translate this into geometries that are much more representative of the true nature of the vascular tree. Essentially, I would like to summarize. I know that towards the end I've gone fairly quickly, but essentially the vision that we have is we would like to develop a full-scale pharmacological model at the system scale. And we believe that using a mean field formalism based on this Langevin dynamics, and of course coupling them appropriately with the Monte Carlo as well as the dynamical density functional theory gives us the ability to do that, because we can actually implement these techniques at the full vascular tree level, which is relevant for clinical translation. But of course, we realize that we make several assumptions in these models, and so in order to either validate these assumptions or buttress these assumptions, we can essentially rely on much more rigorous theories. which are either based on Brownian dynamic simulations or direct numerical simulations, or sometimes even single molecule experiments, et cetera, and then feed the information we get from these more microscopic and more rigorous simulations back into our mean field model to actually iteratively refine the mean field model. And ultimately, the predictions of the mean field model would then be allow us to actually make comparisons at the pharmacodynamic scale with either animal experiments or hopefully even experiments involving human trials. So with that, I would like to acknowledge my coworkers and also support from NSF, NIH, and supercomputing resources from the XSEED environment. And I thank you all for your attention.
Thank you. We'll open up for questions from the audience.
I have a question for Ravi about the membrane ungulation. So do you assume rigid membrane or deforming membrane? Or
no, so yeah, I'm sorry, I had to go through that part fairly quickly. No, these are fully deformable membranes. These are fluid membranes, and essentially what we have done is we have coupled the mechanical Helfrich model and actually thermalized it by essentially simulating membrane undulations at the thermal limit, right? And so no, these are membranes that actually undulate, and then the nice thing is that we can actually include the effect of the signaling microenvironment. So one of the big questions is when such a nanocarrier is internalized, is the internalization purely driven by the receptor-ligand interactions and how it is able to wrap the membrane around itself, or are there other signaling proteins that are curving the membrane from inside the cytoplasm? And so we have developed some fairly sophisticated theories of how curvature-inducing proteins can be recruited and sense these curvatures and then aid in this type of process. So no, these are all thermally undulating membranes, and we take into account curvature fields due to individual proteins that may be present in the signaling microenvironment. These could be bar domains or ENTH domains, or even things like Clapeyron codes and things like that. And how they actually, so then this allows us to actually couple intracellular signaling together with the external physical interaction, adhesive interaction between the nanocarrier and the cell from the outside. Right? So that's kind of the direction in which that project is going. Yeah.
I'll add to that just briefly that one of the things we know from some of the imaging studies is that the receptors are not homogeneously distributed across the cell, and they are diffusible in the membrane. And so even the forcing, as the curvature changes, for instance, can change the distribution and the location of those receptors. So that could lead to enhancement or disenhancement of the binding and uptake. So these are important things to be able to study at these kinds of length and time scales, which aren't easily accessed experimentally.
And another question is, you talk about several different time scales and dimensions. So in the future, how are you going to integrate these different scales together?
So the way we, well, so I think at the generalized longitudinal dynamics level, essentially the integration of timescales that are faster than the timescale of the generalized longitudinal dynamics itself are introduced based on by introducing correlations which are built into the color noise, right? So in some sense, the idea is you can either model the individual interaction of a single nanocarrier with each and every blood cell it tries to encounter along its way as it binds, or you could say over the time scale, right, what is the statistical force that a nanocarrier would experience because of the presence of the blood cells. And so what we are relying on the mean field model is the statistical force, which is essentially built into by the time correlation. And so then the question is, the time correlation is going to be dependent on whether the nanocarrier is going to be at the center of the blood vessel, or is it going to be close to a branch point, or is it going to be very close to the wall of the blood vessel. And in order to determine different regimes of these time correlations, we rely on these hydrodynamic correlations. So in principle, the time correlation functions would incorporate these the effect of these length scales in these time scales in this approach. But that's just one example of how we do this. For example, the bridging of the membrane dynamics with the flow dynamics is something that we have not explicitly worked out yet. But for example, that would not be we would not be able to do that through this time correlation approach, and we would actually rely on a much more rigorous multi-scale bridging. And essentially, one way we could do that is to use a multi-time-step process, such as an equation-free integrator method, like Yannis Keverkidis has proposed, for example. But that's just our thought. We are just beginning to try these things out, and I don't know which of these schemes are going to be exactly successful and how we would implement it. But we would love to get feedback from the community, because I'm sure everybody that presents in this consortium has a very similar, dilemma of how to choose these bridging scales. So we would like to learn from others too.
Thank you.
So speaking of the consortium, since this is a UO1 award from the Multiscale Modeling Initiative, what are some of the ideas that you'd like to have the Multiscale Modeling Consortium help you address?
Well, I can think of two things immediately. One is that to really think about this at a cellular level, we've sort of picked this apart to a problem of what's happening at the cell surface. There are more things to do here in terms of internalization, trafficking, and so forth. So it would be helpful, even cell-cell communication, how those things could be integrated into this, or could take advantage of some aspects of this. And then I think the second thing is, if we're looking at vascular delivery, so what are really the right, this is very different in different organ systems, and at different length scales, at say the arterial to arteriolar length scale, and then at the capillary network. These are not the same in every kind of organ. So it would be helpful to have some insights about architecture for the right kinds of geometries to be considering. And I think that's an important modeling consideration here.
And I would like to add maybe a couple, from a slightly different perspective. I think one of the things that we all worry about is computing infrastructure. So I don't know if this is the right consortium, but maybe collectively we can make some noise. So, we are fortunate to have good computing resources at Penn, and we are also fortunate to get large allocations from XSEED, but it's still not enough. So I don't know if there's discussion in the consortium for other avenues for computational infrastructure. Because we always need more computers than we have. So that's one aspect. And the second aspect I would like, and this is something that that I think is going to become more and more important, is that as some of these models become successful in validating, in a control situation, clearly we are going to start thinking about clinically translating some of these things. And so the idea would be, how would we actually get access to this type of clinical data? So I can tell you from the example of what we presented, one of the things that we would like to have is images of entire vascular trees, for example, where we can actually start implementing some of these flow considerations in actual physiological vascular environments. So the question is, how easily can you actually access this type of vascular tree data? And I'm sure that we can do it ourselves, but I'm sure that other people have already done it. So if there is a repository where we can actually start sharing common data like this, which that would be very, very helpful. Because we don't have to be reinventing the wheel in doing so.
So Ravi, for the two issues that you've posed, you could probably connect with the high performance computing working group in the consortium to present some of the limits of the current infrastructure for high-performance computing, and maybe bring that up as an open discussion.
Sure.
In terms of your second topic, there's also the clinical and translational working group in the consortium, and that could be also another question you can propose to them in terms of where to acquire blood vessel data and that sort of thing. We also have a general MSM forum on the main wiki where you can pose more generalized questions if you think the working groups haven't covered it.
Sure, absolutely.